And if you want to live to be well beyond 100 chronologically, say 110, 120, 130, 140, 150, 160, 170, 180, 190, 200, and be biologically 30, 40, 50, contact your young to be associate and ask for the books Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book Immortality, and the book Rare Earths and Cures. And you'll learn how the top 20 longevity cultures on Earth actually have 40 times 100-year-olds we Americans do. They have 100-year-old per 250 of their population. We only have 1 per 10,000. What are their secrets? Well, contact your young to be associate and ask for the book Epigenetics, the books Immortality, and the book Rare Earths and Cures. Okay, Doug, let's go to callers.
All right, let's head to Colorado Springs, Colorado. And Hal, you're on with Dr. Wallach.
Hello, Hal, you're on the air.
Yes, Dr. Wallach. I've had Shingles and Groves for almost a year now, and do you think that would interfere with the absorption of your minerals?
Well, tell me about Grovers. How does that manifest itself? I'm not familiar with that.
It's just little, places that itch.
Oh, itchy spots. Okay. Mm-hmm. Okay, that's useful information, actually. Okay, how much do you weigh, sir?
About 90, right about 100 pounds.
Okay, and how old are you, sir? What is your age?
75 or 76. Yeah, 76.
Okay. And let's see, we've got your weight. Do you have any other issues, any diabetes or high blood pressure or arthritis?
No.
Okay.
Blood pressure is slightly on the low side, I suppose.
Okay, so low blood pressure. Okay. All right. Okay, did you have asthma as a kid?
No.
Did you have your appendix out?
Yes.
Yes, okay.
When I was 2 years old, but so, I guess.
You were how old?
Oh, I guess I was about 10.
10 years old and had your appendix out. Okay, that'd be pretty typical. Yeah, you have what's called gluten intolerance. This causes itchy skin, it causes constipation, it causes diarrhea, it causes things like low blood pressure. It will cause you to have your appendix out, irritable bowel syndrome. All this stuff are symptoms of a gluten intolerance. When you get 3 or 4 or 5 or 6 or 8 of them, then definitely you've got gluten intolerance. It's an absorption problem. So the first thing I have you do is change everything you're doing as far as eating. You have to give up fried foods, no exceptions. No deli slices with nitrates and nitrites. That means no deli slices, no sandwich meats, no sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, Spam. And that's going to get rid of those inflammatory things. And then you have to give up oils. It means microwave popcorn, theater popcorn, things like olive oil, coconut oil, margarines, mayonnaise, salad dressing, cooking oils. And lastly, no gluten, no wheat, no barley, no rye, no oats. This would include dog food, cat food, bird food, spouse, mother-in-law, renters, anybody living. Okay, Doug, let's go right back to Colorado and Hal. Okay, Shar, are you there? This is a Shar thing.
I'm here.
Okay, this guy has skin problems, kind of a eczema over his chest and his back. That's the Grover's disease.
Yep.
And then shingles, okay, which is a chronic viral infection of the skin. He has, let's see here, low blood pressure, which is mineral deficiency. And he's only 100 pounds and 75 years old. All right, and so he's had his appendix out. What would you do for this guy?
Well, obviously the first thing is to get him on a gluten-free diet, and then I would give him, for the shingles, he needs to put colloidal silver on it topically, and he needs to take killer biotic internally, and he should get on I guess if he doesn't have any other problems, just get on a Healthy Start Pack.
Okay. What would you do for his immune system? Get his immune system up in addition to the Healthy Start Pack.
I'd give him the BTT 2.0 capsules.
Good, excellent. And what else? Good for the heart, good for the brain, good for the liver.
Oh, the selenium.
Well, there you go. Exactly. So at 100 pounds, Hal, you need one Healthy Start Pack, as Shar says. Get yourself 2 bottles of our Ultimate Selenium. Take 3 at breakfast, 3 at dinner time. And the killer biotic is going to support your immune system and actually has antimicrobial properties and can kill bacteria and viruses and so forth, which includes shingles. And I'd go ahead and take 2 or 3 of those twice a day. That's 2 bottles a month. And topically on top of the shingles, as Shar said, you get our Envision colloidal silver and soak a cotton ball 2 or 3 times a day and keep that shingles area, even if you don't see the blisters anymore, it's just painful. You can go ahead and soak those areas, keep them wet with the colloidal silver for about 10 minutes, 2 or 3 times a day. And let's see here, for the itchy skin from the Grover's disease, just for a little bit of symptom relief, what would you do for the itchy skin, Shar?
He could put CM cream on it.
You get an A+. Okay, yes, I'd get you a couple of bottles of wide mouth jars of the CM cream, and you can go ahead and smear that on lavishly over the places that are raised and bumpy and red and itchy. And, within 5 or 10 minutes, you're going to get significant or total itchy pain, discomfort relief for 3 to 5 hours, so you may have to apply it 2 or 3 times a day. But on a gluten-free diet, within weeks, you should be free of this sort of thing because these are all secondary to a gluten problem.